everybody, welcome back to the Concussion Crew, your go-to place for all things concussion recovery. I am so excited to have with me Dr. Rae Teixeira. She is in charge of my vision therapy care, and she's going to explain to us a little bit about what vision therapy is, how it can help, what it can target, and all the other things that I can't remember because I got a concussion.
I love that. Thank you so much. I'm so glad we're doing this. Yes, we do vision therapy, and I am a neuro-optometrist, but I also had a concussion of my own in October of 2020. So that really gave me a different perspective on everything, and I think we connected on that when we met.
Yes.
It's something that a lot of the symptoms you can't put into words, and I still have a hard time putting into words, but we'll be like, oh yes, that, you know? So it's one of those things, and vision is so much more than 20/20, and I'll say that a couple more times, but if you've been told that your vision's fine because you see 20/20, but you know that something's wrong with it, that's kind of where we begin.
And I'm going to jump in right now and just say that Dr. Rae is my doctor. She is not your doctor. This is your medical disclaimer that this is not medical advice. Make sure that you connect with a doctor, and we are going to talk about how you can find someone almost as awesome as Dr. Rae. Almost. So, Dr. Rae, what is vision therapy?
Yeah, so vision therapy, I think a lot of people haven't heard of it, which is funny because it's been around for so long and there's so much evidence to support it. When you think of the visual system, it is composed of the eyes and the brain. And I think we often forget that we actually see with our brain. If our eyes and our brain were disconnected, we wouldn't be able to see properly. And in the instance of a concussion, what happens is that connection, it's almost like a wiring. Something goes wrong between the eyes and the brain. And if they're not working together, then we're not seeing properly. So you can still see 20/20, and that's what I was referring to before. You can still see perfectly fine, but it may be doubling, it may be shadowing. You're going to get maybe headaches or visual strain when you're trying to see. So the whole premise of vision therapy is to address, okay, what's going on? Where in this visual pathway have we gone wrong? And there's a lot of different areas that can be affected. And how do we implement a program in order to rehabilitate that in that way? I think it's 2/3 of the brain is devoted to vision, so it's the brain pathway. So I can't remember the actual statistic. I think it's maybe 50% of the pathways in the brain are connected to vision. What that means is it's no wonder that vision is one of the first symptoms that's affected. You think about concussion patients where we have our sunglasses and our hood and we're like shielding ourselves from the light. So it's one of those things that it's no wonder that it's affected, but it's not often the first thing we think to address.
And it wasn't even something that my family doctor recommended.
No.
You know, physiotherapy, occupational therapy, you need vestibular rehab.
Yes.
And
all important, right? Like they're all important pieces, but it's just funny that that's not the first, it's one of the biggest symptoms, but we're like, it'll figure itself out.
Right?
You know, so that's one of the things.
How do you work together within a healthcare team?
Mm-hmm. Everyone's different, but I do think collaboration is a very, very important thing. There's so many other practitioners that I refer to, and we kind of hand off patients in order to have the best care, because I'm not a specialist in vestibular, you know, other people aren't specialists in vision. I think it's important to really collaborate, but make sure you're not overwhelming the patient with too many therapies. So I refer out for craniosacral therapy, which is massaging of the actual skull, which is very interesting. Vestibular therapy for sure. There are so many different therapies, and I think being with someone who's open to exploring different possibilities is a really good sign that you're with a good practitioner.
Yeah.
Nutrition is also a huge, huge role. There's so many pieces at play, if that makes sense.
Definitely.
Yeah.
Definitely. I talk about your awesomeness and that you and Jordan communicate and will pass things off to each other, which is amazing.
And it's nice with him specifically. I can text him or he'll call me or whatever else. It's really nice in that regard. Some people don't have that working relationship, but I always make sure that they have all of my notes so that there's continuity of care, because I think that's important, especially with a concussion patient. You're not going to remember everything that I'm telling you. We want someone to kind of have that thread that holds everything together. I do know some neuro-optometrists who say, okay, while you're doing my therapy, we're not going to do any other treatments, because sometimes we can start something, and if you start doing something wacky with your vestibular system, it can mess up what we're doing. So sometimes we do things in isolation, but it just depends. It's case by case.
That's fair. After my concussion, I asked my family doctor, how long is this going to take? Like, what's going to happen? What's next? And she said, well, once you've seen one concussion, you've seen one concussion, because they're all different.
Very, very well put, I would say. Yeah. And it's even funny, when I got my concussion, it was 6 months after I graduated and got my license. So I just paid all this money to get this information into my brain, and then I had no working memory. And there's so many things, it's hard to know exactly what to do. It happens so suddenly, you never think it's going to happen to you, right? And I'd been treating patients with concussions, but then when I got one myself, you kind of go into a patient mindset where I don't know what to do. I don't know what to kind of work with. And luckily I work here and I started vision therapy right away. So it was very helpful in that regard. But oftentimes, when I see people, except you, same thing, you've done every therapy before you've come and seen me. And you're like, okay, I've tried this, this, and this, and I still have symptoms. So then we kind of go from there, right?
What are some common symptoms of concussion?
I would say, well, what did you notice? Visually.
Visually, I noticed that I kept on tripping over the curb.
Absolutely.
And I went to my optometrist and got new glasses, and they were progressive, so the headaches got worse and the tripping got worse, and they were the right prescription, just not the right.
Your brain was like,
yeah,
absolutely.
Even. And then the headaches and the migraines and forgetfulness.
Yeah. So I would say the first thing you said was stepping off curbs. That's depth perception. So not having depth perception is it's how you interact with your space. And that's one of the main things. If you walk into a grocery store or a visually confusing space, it's very overwhelming because oftentimes we close off our space to protect ourselves. It's a protective mechanism. So we have tunnel vision and we have no depth perception, and everything's so overwhelming. I often tell people, if you are in a situation like a party or a family gathering and it's just overwhelming to you, position yourself so that you're actually facing the wall and you're only talking to one person at a time, because that eliminates, as opposed to being facing all this visual confusion.
Yes.
Face a wall just to kind of eliminate that, so you can focus on one thing at a time, because it's hard. You don't want to isolate yourself from social environments. I mean, you have to sometimes, but that's a good little coping mechanism there. So depth perception, headaches with visual strains. When we're trying to use our eyes and they're not working properly, we get headaches. Sometimes blurry vision, it'll come in and out, so you had a prescription change. That might have been from our focusing system not working properly. Double vision, a lot of people get double vision. And then visual processing is what we actually look at. That's something that you wouldn't necessarily notice. Visual memory for sure. And I don't know if you remember when we were looking at shapes, sometimes you'd say, I know that's on a diamond, but I can't say that, right? So visually, that's your visual processing. You're seeing something, but you're not computing it. So that's that eye-brain connection. We can see it. It's not that the eye's broken. That's not the problem. It's the brain. So that's the main thing, is we do see with the brain, and that's really what we're working with, and that with the neural plasticity to make sure that the vision and the visual system remediates itself.
That makes sense.
Yeah.
I think one of the surprising things for me was the impact that coming here had on my emotional well-being.
Absolutely.
I cry less now, like everything calmed down once my eyes stopped freaking my brain out.
Absolutely, and I think that's a very important symptom that we don't discuss. I was extremely depressed, and I think that's something that, one, you've had this huge life-altering event. Two, your nervous system is going crazy. So, like, I would cry at the drop of a hat, and we cried together. Like, it's just how it goes. But it's also something that it's such an isolating thing. And I mean, I had a concussion one year, and then I broke my leg the other, and the broken leg didn't. You know what? It didn't bother me, but everyone's like, "Oh my gosh, your leg! Let me hold the door." Okay, when my brain was in scrambles, no one knew. So it's just something there. I think that's a huge thing. Emotional instability is a huge thing that comes along with your nervous system being dysregulated, which is where we use the syntonics, and we'll talk about that later. I remember at one point I was doing one of the activities, which we can do later, with the Marsden ball, and I'm hitting it, and I just started hysterically crying when I was doing my vision therapy. And my vision therapist is just kind of looking at me. She's like, what's going on? What came up? And it was actually the noise, and that was the noise I guess I heard when I hit my head. Yeah. The noise just triggered something in me. So I think when you do cry and all this stuff, we kind of move through it and we identify what's going on. It's not directly related to vision, but we kind of go with everything throughout, right? And it heals wounds we didn't even know we were kind of still dealing with.
Yeah.
That makes sense. So
100%.
yeah.
I'm going to link to a video where we talk about the emotional process and why you shouldn't just tamp it down and be like, oh, I can white knuckle through this, but feel the feelings because they're there for a reason.
Absolutely. And I think that's really important. I think I spent a couple months being like, oh my gosh, what's happening? I just have to like get back to the way I was, get back to normal. Okay, I'm just, I'm doing all this to get back to normal. And it was only when I gave myself some grace and I was just moving through things, I slowed down as opposed to just trying to muscle through things. So slowing down, taking a step back, taking some time off, not working full time when I had a concussion, very helpful. So yeah, I think that's a really important thing. And then just going back to symptoms, most symptomatic concussions resolve within about 3 weeks. I think it's 80 to 90% resolve within 3 weeks. So if you're someone who's thinking, okay, you know what, it's going to resolve itself, I'm just going to keep going, and you're hitting the 1 month, 2 month, 3 month mark, it's probably time to seek help if you haven't done so already. And if you're going to your family doctor and they're saying, don't worry about it, you'll heal, you'll start to feel better, just give it time, rest, all that stuff, just seek other advice from other healthcare professionals because everyone, like we said, has their own specialty. So just kind of do some more research and advocate for yourself. Connect with me, connect with Larissa. We can definitely support you in different ways, which is nice. But I think that's the thing. With symptoms, if they haven't resolved, of course you're going to have symptoms right away. And I actually started vision therapy within 2 weeks of getting my concussion, which was a lot, but it did help and it was very slow but sure. But if you're still having symptoms after 3 weeks, definitely get some help.
I think it's frustrating because you see these NFL players that take a hit and they've got a concussion and then the next week they're back on the field and you think, why am I off work?
Right.
Like, he just went back out there, so.
Right. And that's what they're trained to do, right? So it's something that they've probably had multiple concussions. It's always funny when I have an athlete come in and they're having symptoms unrelated to concussions and I say, have you ever had a concussion? And they say, no way. Especially boxers. I'm like, oh, okay, that's nice. Sure. But that's something that they're trained to do that. And I think return to play is now becoming a big thing, especially we deal with it so much with kids because it's very, very important for brain development. But with these athletes who have had multiple concussions, it's almost more important with them too to make sure that they're being safe in that regard. So I know the NFL has had a lot of pushback on that. And athletes in general, there's this whole stigma, okay, I can't tell anyone if I'm hurt or if I hit my head, or because they want to return to play, and I get that, right? So it's hard because we often get withholding of truths and stuff like that, and it comes out eventually, but yeah, it's tricky.
Mm-hmm. You went to school, you're not just an optometrist, I use the word just, like, just a doctor. What education have you had? How are you different from a regular eye doctor?
We all graduate as an OD, so that's a doctor of optometry. I did my schooling in the States, in Chicago. You graduate with your degree, you can then do a residency in certain specialties, so ocular disease or binocular vision. Just an easier way to think about the difference between regular optometry and neurooptometry is we often differentiate the difference between sight and vision. So sight is 20/20. That's our goal, is to get you seeing perfectly from a clarity standpoint with either glasses or contacts. So if you come in, you can't see, we give you glasses or contacts and you see 20/20, you're good. The difference between that and vision is, yes, with vision you can still get to 20/20, but is it double? Can you see depth? Are you overwhelmed by your vision? Do you have light sensitivity? So that takes into account the actual eye-brain connection. So the difference ultimately between regular optometry and neurooptometry is incorporating that brain aspect and vision as opposed to just sight. So years ago, 10 plus years ago, regular optometrists didn't learn neurooptometry in a regard where we're going to implement vision therapy. They learned about binocular vision, which is what we're dealing with, both eyes working together as a team and working with the brain, but there wasn't as much emphasis on that as there is now. So now new grads are coming out, and whether they choose to practice in vision therapy or not, they're at least aware of it. And that was one of the huge hurdles we have and still have when we're dealing with optometrists who haven't really learned this, or ophthalmology as well. It's just, if you don't know something, you don't necessarily believe in it. So that's a really tricky thing. So I think just educating and kind of being open to discussing it with other doctors. I was very fortunate to work with Dr. Hellerstein, which she's a fantastic neuro-optometrist, pioneer of our field. She's written so many books. She's incredible. Huge fan. And she's actually reconnected me with this practice. So she owns a practice in Colorado. I did one of my internships there, and I learned so much. I worked with concussion patients. I worked with kids who were gifted, but their visual system was holding them back. Kids with learning disabilities. We did sports enhancement. So people with normal vision, but we are enhancing their vision to make them more accurate. So that's kind of where I did most of my training, and I really sparked my passion for vision therapy and neurovisual assessments.
I think it's important to know that just because you have a family optometrist that you've seen since you were a child, if you have someone who is not encouraging you to seek vision therapy, we need to advocate for ourselves and really get out of your comfort zone and find someone new. Go for second opinions or third opinions if you need to get the help that you need.
Yeah, absolutely. And I think I'm not going to steal you from your regular optometrist. We'll still refer you back there after. So if you want to continue your routine care with them, that's absolutely okay. I think we both do different things. I can do glasses and stuff as well. But if I'm just your specialist for the neuro-optometry, we focus on that, and then you go back to them for your regular care, that's fine.
And when you go back, you can take the stories
Yes,
back. Like,
exactly.
look how much better I am. I'm not throwing up on your floor. You're welcome.
I mean, you're welcome. So that's something too, is just, then you open up that connection. I've worked with different optometrists who didn't know about it, and now they're our biggest referral sources because now they've seen all the changes that we can make, right? So I think some people get really frustrated. Okay, you don't know about this. That's ignorance. That's this and that. I think we just educate people, and the more people, if you see this great success story, you're not going to be like, oh, this doesn't work. I mean, it does. Yeah. It's just how it goes. So I think going back to your question of what's the difference between a regular eye doctor and a neuro-optometrist, so a regular optometrist versus a neuro-optometrist, we both have the same foundation, but it's, if you're interested in learning more, there's always that to be learned, and you can practice that.
Exactly. And how do you find someone? Is it just like Google vision therapist in my area?
So I mean, you can do that. Just type in vision therapy and see what comes up, and you'll be able to read their different websites. I think that's the easiest way. But if you want to know, so there's vision therapists that can practice, and they're trained by the doctors they work with, or there's actual certified vision therapists. So both Trisha and Christina are certified with the PV TAPS program. So if you go onto Vision Therapy Canada, VTC, they will actually have a locator of all their registered therapists, which would be really helpful. So that's if you're in Canada. If you're in the States, you can go probably through COVD. And again, just Googling in your area, I think there'd be lots of connections.
I'm going to find those links and make sure that I put them below so that you can click through easily.
And if you're in a place where you think there's, you can't find anything, let me know. I can try and connect you. I did go to school in the States. I have friends abroad who are optometrists as well, so I can try and connect you with someone as well.
I will include Dr. Rae's email address and her Instagram, so head on over and follow her. And when does somebody reach out? Do I get in a car accident and make a phone call, oh my gosh, or do I wait a couple weeks to see how symptoms are, or you said a 3-week mark? When?
Yeah, so I think it depends. Again, I'm in a very unique situation where I'm in a practice, I already practiced it, I have wonderful practitioners here who helped me right away. I do think I might have returned to work a little bit too quickly, so I needed all those resources in order to help me. I was wearing these funny goggles, which we'll show you afterwards. I think you've seen on Larissa before. I had to wear those until my neurofunctional lenses came in order to just be able to see patients, to calm down my nervous system, which was very funny, especially for kids. They loved it. But I think there's no right or wrong answer. Like I said, oftentimes when I see patients, it's been months to years after they've had concussions because they don't initially think of vision. They've gone to vestibular training, chiropractor, physio, multiple different avenues, and they still have this residual symptom, and they think, okay, maybe I'll check with my optometrist. And sometimes it's coming in and saying, okay, you probably don't deal with this, but But then I do get referrals within a couple weeks of having concussions as well. So I think if you have visual symptoms, you don't have to wait till the 3-week mark. Come in right away as soon as you can, but there's no rush. Don't feel like you have to come in or you miss the boat. a story about that. My sister actually, when I started practicing before I had my concussion, she's a nurse, she's an ICU nurse, so she's also in the healthcare field, and she was a rep soccer player when she was younger, so she had multiple concussions, and she had to stop playing soccer because she had a very bad concussion. Fast forward many years, she's very successful, she works in the ICU at sick kids, like she's achieved all of her goals. But one day I was FaceTiming her and I noticed her eye just drifting off to the side. I was like, hey buddy, what's going on with that? So we brought her in, we did a full neurovisual evaluation. We put on those goggles where we track the eyes while they're reading. We found out she was reading at a grade 4 level, which was really, really hard for her, for all of us to kind of find out. And she broke down into tears because she said, I always thought I was stupid because it takes me so long to read things. I have to reread everything. I have to work way harder than everyone else, and I don't know where this started from. Well, 15 years ago, she had multiple concussions, and she was still having symptoms that she was able to overcome because we're all very, very strong people. She had to work way harder than most people. So we were able to, 15 years after her concussion, still do vision therapy with her and remediate her back to where she should be. And I'm laughing because she got all the way to grade 8 without ever reading a book and doing book reports because she was just so smart at memorizing things and putting things in.
Clever
and now
girl.
she hated reading, and now she reads all the time, which is a really big thing. So just to see someone go from hating reading, and I've known her my whole life, so she hated reading and now she loves it. So that's definitely a huge turning point. So it's never too late to do therapy. And if it's too early and we think it's too early, then sometimes what we do is we will start you in a neurofunctional lens, calm down your nervous system, and then we start vision therapy later. So don't feel like if you come in, we're just going to throw you right into things. We just gauge it based on each patient and how you're doing.
And that's the mantra, I'm going to say, the whole way through, right? We're going to talk a little bit about that in the exercise room, but I started crying. We were doing a car activity the other day, and I just became overwhelmed, and so Christina brought out a color block game and just scaled it back. And
that's exactly, depends, everyone's higher level is a different thing. For me, it's easy for me to go fast, so slowing down would make me cry because it's overwhelming for me to do that. But for some people, going fast makes them cry. So it really depends on the patient. Just because you can do this doesn't mean you've won, doesn't mean you're graduating. You have to kind of be able to do multiple different things. It's very custom to each patient.
So something that I appreciate is that you also ask, what are your goals? Often, you and Christina, what are your goals? What do you want to accomplish?
I think it's really important, especially concussion patients. Your whole life and what you view as important has been taken from you. So what I view as important in my life is very different from yours, right? So having a goal-oriented rehabilitation process is very, very important. I think when you first came in, you're like, I'd just like to be able to not puke when we're having a conversation. I'm like, that's reasonable, And then after we kind of accomplished that, now we're like, okay, well, what would you do if, and it's nice to have goals in a positive way, because I think we get so used to being sick and we get so used to being
in pain.
It's our whole identity. So it's something that it's very, very important to have that to look forward to, and that is the goal. It's almost like manifesting, thinking about that, envisioning yourself in that life, and then you can kind of work towards that as opposed to being like, well, I didn't puke today, so that's good. Which is good.
Which is good. And the changes at the beginning are so small and incremental that the big goals don't feel possible.
Absolutely.
So,
And it's kind of, we've done that, and actually with you, I'll show you my notes throughout, but we have woven that in throughout, where we just kind of plant the seed and then you kind of come back to it. Because it's overwhelming to be like, oh yeah, you're going to start a YouTube channel, you're going to start a website, you're going to be extremely successful, everything's going to be beautiful and perfect. Like, it's hard to be like, oh yeah, sure.
Would not have believed you.
I know. I think attainable goals, customizing everything to each patient is so important. And enjoying it, because if you're not doing something that you think is going to make you better and you're not working towards something, it's very hard to achieve.
Approximately how long does vision therapy last? And I say this knowing that every concussion is different. You're not going to be able to answer this question, right?
Yeah, I can give you, rough estimates. Usually we do, especially at Vision Care Center, we do 10, 20, 30, or 40-week programs. 40 plus is usually what we say. And it really, really depends on the patient. We also I do patients with learning disabilities. We don't just do concussion. So I think the one differentiation between concussion and developmental is if it's a developmental problem, you're born without this ability, or your eyes and your brain have never really known how to work together. It's very different from your brain used to know how to do that before a concussion and it just forgot. You're reteaching it a skill it already knew how to do. So sometimes that does happen quicker. That being said, there's other things that come up with concussions that can make it trickier. With developmental, sometimes that's what takes longer. So if I have, a 5-year-old whose eye is turned completely in and it's never known how to point straight, how do you convince the brain, okay, we want to keep our eyes straight, right? So that's usually when we get into 40 plus weeks. I think for me, it was 35 weeks for my vision therapy. It really, really depends, and it's non-linear. So you kind of said that before, you get small gains. I think I was kind of going up, and I was doing really well, and then I hit a plateau, and that's very frustrating. And then I don't think I regressed at all, but then I started to go up and then plateau. So it's just one of those things you have to give yourself grace and kind of keep going throughout. And once we hit plateaus, we switch what we're doing.
One of the big things for me was coming around to, it's not a moral failing. It's not, everybody plateaus, we're human.
And we're human. And going back to giving yourself grace, I think it's really, really hard, especially for high achievers. It's like, okay, well, I didn't do 100% today, and now I failed at life. And that's all we can do when I'm done.
Yeah.
It's just, it's not true. So it's something that is a really big, that's the whole emotional thing, saying, okay, we become less emotional throughout, not less emotional, less emotionally unstable, I think is the best way to say it. I'm still emotional, but it's something that you kind of learn to adapt throughout. And I would say even before my concussion, I was much more rigid. I had to get everywhere on time. I had to work out at 6 a.m. I had to do this, this, and this. And it's really taught me a lot. It's almost like a superpower in a way where I've had this huge adjustment where I'm more flexible now. And that's something that I didn't have before.
And it's helped me to have people. I came in at the beginning and Joanne, I was crying and I said to Joanne, I had a headache and I couldn't do my exercises at home one day. And she's like, okay, no. It's like 7 days a week is not reasonable. But I was like, but no, it's homework and you do it every day. You said every day.
I follow instruction. So actually, for some patients, I'll build it in. I'll say, you have 3 days of homework and you have 2 days of rest, and then you have 1 day here. So some people really need those guidelines, especially with a concussion. You need to be told exactly it, right? So it's really, really hard because it's hard to give yourself grace. So absolutely. The way vision therapy works, Larissa comes in, you see Christina or Trisha, whoever you're working with, and you do a 45-minute session to an hour session. And then you go home and you do your home exercises at home. That program was designed by the neuro-optometrist, so myself or Dr. Amesh at this practice, whatever doctor you're working with, and then we check in with you. So I think it's every 8 weeks that I usually do, and I see, okay, what's working, what's not, how do we modify, and how do we go from there. So it's really, even if we tailor something at the beginning and we're noticing that doesn't work as well, we kind of adjust it as we go, and you outgrow certain things, so it's kind of important in that regard.
And the exercises at home are it's not hours, it's,
it's manageable.
It's very manageable.
Yeah. And we can customize that as well. At the beginning, doing 5 minutes of something might be the absolute maximum we can do. Most we do is 20 minutes, absolute high end. But again, I work with a lot of kids too, and they're like, what, 20 minutes? It's just crazy. So, and I try not to call it homework with kids because they're like, oh my gosh, I'm more homework, this is just what I need. But it's an activity you get to do at home, and it's not crazy. It's nice to do it in your own space. I kind of just built it into my routine. So if I didn't, then I would forget to do it because of concussions. So usually it was in the evening, before I brushed my teeth, I'd do a couple exercises. There's one I would do in the morning because it woke me up too much. I'm a bad sleeper anyway. So yeah, you just build it in. It's not too bad at all. Yeah, which is good.
My cat loves when I'm doing Wily Cats,
which
we're going to look at later. She'll come in and be batting at the eraser. I'm like, okay, so we're not doing Wily Cats today now.
Your eyes are fine. With regards to risks or side effects, there's not really any risk. There's always something to be gained. I think the most is that we may agitate the symptoms a little bit, but we do warn you it's a safe space when we do it. We're not going to push you over that hump. So push you as far as we can, but if we see, we don't want to push you into kind of overdrive, right? Where we are puking, we are doing certain things. Sometimes that happens and it's inevitable, but it's something that we try not to do. So we're trying to push you to get growth and to get gains, but we're not doing too much. So I think there's no long-term risk of anything like that. It's mostly just you may have a little bit of a headache, you might be very fatigued afterwards, but that's all good things. It's all showing growth, which is good.
Yeah. So should we go experience what an blooper reel? What am I saying?
Should we go see what a vision therapy session looks like?
There you go. We're gonna let her say it.
Okay, so we'll head to the back and we'll see what vision therapy is really like. So this is our vision therapy space. We've got lots of fun equipment. I'm just going to show you the whole room. We've got all of that. We have a nice balance beam. Have you been on the balance beam, Larissa?
Yes.
It's fun. It's scary, but it's good.
Terrifying.
I know.
Good.
We've got so many fun things. We've got all of our lenses here. And we've got some vectograms. These are ones where you have to use these special stereo glasses. So it separates what you see in each eye. And then you either do it at a distance, or you can see that little light box in the corner. You can also do it at near as well. So seated or standing. And it really changes how you perceive things. We've got some more equipment over here. And then one of the really cool things that you'll get to do at the end is this is after you graduate. We have this lovely tree over here, and you get to put your thumbprint on the tree. So you get to see kind of how everyone is part of a whole collective. You're not just one person, but it's a really nice thing at the end. When you graduate, you get your thumbprint on a tree.
I love that.
The most important thing with activities is that almost all of them are scalable. So Larissa's going to sit for this one. You can stand. Depends on how you're feeling. Some days you'll be able to stand. Maybe the next day you'll have to sit. It just depends on how you're feeling that day, whether you've been to see Jordan or not. You know, it just depends on what your energy level is. So this is a ball, a Marsden ball, and it has letters on it. So working what we talked about before, visual memory is a huge one. So, okay, I'm seeing something, can I remember it? But visual processing. So you're seeing, I'm going to be showing you a letter. Can you say a word that's associated with it? Can you say, you know, if you're seeing green, can you say something that's green? There's many things that we can do where we can see something and we connect it to a thought, which is important. So we start with this. Sometimes we start just by saying the letter. Okay, what do we see? Can we say that letter, right? Then we say, what can we see? Can we say any word associated with it? And then we can do, what can we see? Can we say a specific, you know, fruit or something like that? So there's many levels which we can do, and sometimes we'll try this and it just doesn't work that day and we'll just not do it. It makes you feel really crappy. We don't ever want to do anything that makes you feel too bad.
And I think that those days are really when there's something that you can't do, and then 5 weeks later you try it again and you get it. Yeah, it feels like
it does. It really does. Okay, so let's try this one.
I've never done this before. This is brand new.
I'm usually not in the vision therapy room, so we're going to try everything new. So as it comes towards you, you just say whatever. If you want, do you want to start with just saying the letter, or do you want to say the word?
Let's try the word.
Okay, let's try it. So I'm going to send it towards you. You're just going to track the ball, and the first letter you see, you say a word.
Okay. Kangaroo.
Yep.
Elephant.
Perfect.
It's Animal Day.
Oops, too spinny.
C. T.
Yeah. Good.
W.
Yeah.
Okay. Walrus.
Amazing.
Anaconda.
Yeah.
Why not? Octopus.
Extra points.
Gorilla.
Yeah, perfect. And it's a lot, right? So you're focusing, so that's depth perception. How close is it getting to me? I didn't like when things came close to me. That was something that would trigger an emotion with me. Mm-hmm. And sometimes just having it come close enough, that's okay. Then we can also, you know, it'll come to you. You have to, I'm just going to do it to myself. You have to catch it. And then you release it. And then you catch it. So that's another motor component that we're seeing something. Can we catch it? Can we say a word at the same time? very advanced, but we can do that as well, which is good. So that's just one activity. It's a very basic one, but it does help, of course, with so many things. So it doesn't have to be the fanciest equipment, which we do have a lot of fancy equipment, but it can be something simple that can help as well, which is great.
Doing things like sitting down, standing up, using my cane. Some activities I don't use my cane for, and I have somebody standing next to me and just trying to walk without grabbing onto their arms. So you guys are great at
supporting, right? Like, I think you have to feel safe if you're going to try and push your boundaries and going to try and do something. You want to feel extremely safe. You already are in, somewhere that's not your home. Maybe all you wanted to do that day was get out of the house and come here, and then we just do a couple activities, and that's, as good as it gets.
You need to be safe and you need to feel safe. If you're in a space and they're like, you can do it, just try it, and grab your cane away from you, it's okay to move on to the next clinic. Try to find somebody else. And it's so frackin' overwhelming. When I moved from up north down to Pickering, the thought of trying to find new healthcare providers was overwhelming.
Yeah.
So I get it. If you're there and you're frustrated, you deserve to be frustrated. It's a hard situation, but you can find yourself someone as amazing as Dr. Rae.
And I think if you find one good person, so if you find maybe a chiropractor that's really awesome, ask them if they have any ideas of other practitioners that they like to work with. It makes it a little less overwhelming if you just focus on finding one person, then they can connect you. But I think you're starting this amazing community. This is the whole point, is to connect people in a place where you feel very disconnected and isolated. I think it's really important what you're doing. So it's great through here too. Thank you.
Oh, if you think that, I'm in too bad shape, I can't even start, they'll start slow and work up.
Mm-hmm. Yeah, you don't have to be a certain entry level to get in. We kind of meet you where you are, and I think that's the most important in any practitioner you're working with, that they meet you where you are, because it's something that can be so overwhelming. And if you think of our nervous system, it's fight, flight, or freeze. So if we push you into that state where we're making you feel unsafe, then your nervous system goes crazy. And it's already probably going a little crazy, so we shouldn't even be activating that in general. The one thing we do with nervous system is the syntonics.
Yeah, if your vision therapist doesn't make you wear funny glasses, get a new one.
Yeah, it's not even real.
Not worth it.
So we have many funny glasses. I could probably find me in my concussion days in funny glasses as well. And I actually still use these ones. So these are syntonics. I'm going to just show you close. There's different colors to the lenses. And we test you to see which ones work best. The one that you commonly use is a very good pain reliever, and it is a calming color. So it very much so calms you down. If you think of different colors, they evoke different emotions. So if you were to see nice reds and oranges, you would think of a sunrise, right? That might be calming for you. There is green, too. If you think about the spectrum of color, the spectrum of light, green is pretty much in the middle. So that's our it brings you back to balance. So we like to do after certain colors, we bring you back to balance with the green. And there's fancy names on them. Mu, Upsilon, Omega, D. There's all these different Greek words, but we like to call them by their colors because that evokes different emotions, just saying the green goggles or the blue goggles. So with these ones, you can show them how beautiful you look. I'll wear the green ones.
Excellent.
Amazing. And sometimes you just go, you can see people relax when they put them on, right? And we look pretty good.
Always. Yeah, when I'm having a bad day in here, if I lose my balance, if I get panicky, because I feel off balance, we'll put on a pair of these. If it's a really bad day, they'll slap a weighted blanket on me. And
sometimes you just have to lay on the floor.
Sometimes you just gotta lay on the floor.
Yeah, and that's kind of it. So these, oftentimes we do these at home. So I prescribe these in different cases. I have a lot of kids who are really high strung, they can't sleep, anything like that. This really helps with that. Digestive issues, if you think about parasympathetic nervous system. So I guess sympathetic is fight or flight. It's if you're running away from a bear, that's activated because it saves you, and that's where most of us in concussion land are. because we're trying to protect our bodies, especially initially right after a concussion. Your sympathetic or your fight or flight is ramped up. So that's one of the things in here we really try and ground you and bring you down from that. And that's why we use that end of the spectrum, and it really brings you into a nice calmer state. So that's really helpful. But then our parasympathetic is rest and digest. So we want to activate that before we sleep, or if we're too activated, we need to bring it down, or before we eat. So sometimes we do that with that as well. A way you can test that at home, whether you are in parasympathetic or sympathetic, if you have just a little flashlight, even your camera flashlight, you'll have to get someone to do it on you and watch. But if you shine a light into your eyes, your pupil should constrict, right? So that black spot in the middle of your eyes should constrict to eliminate the amount of light. So that is your parasympathetic. If your sympathetic system is in overdrive, it will constrict and then it will shoot right back open again because it can't maintain that level of calm. It has to be looking for the bear or looking for the next thing. So that's something just to kind of evaluate at home. You have to watch very closely, but if you shine a light in, it constricts and then your pupil, it just opens right back up. It's a good idea to look at maybe balancing your nervous system a little bit, going to see a neuro-optometrist, or if you don't have access to that, really doing things that calm you down and activate your parasympathetic.
And I will link to our videos on grounding exercises and how to start meditation. And it's a guided meditation. You can do it in 10 minutes or less, and it's a great way to get started meditating. So if you're sitting there saying, I'm freaking out and I cannot lie down, you can handle this meditation. We got you covered.
Perfect. It's all about, I guess, meeting you where you are. So I think that's a really good place to be. In neuro-optometry and vision therapy, we work with a bunch of different tools, mostly focused around light. So we just looked at filters, which change the color of light, which changes how things in your body interact, so your nervous system. We also work with prisms. So small amounts of prisms, or any prism, it shifts where light goes. So if you're putting light through a prism, it can shift things down or up or to either side, which your brain and your eyes react accordingly. So one of the things we do to really calm down the brain initially, so what I was saying before, if you come in and you're just too overwhelmed, you can't start vision therapy right away, we start you in neurofunctional lenses. So that might have tint, that might have prism, it might have both, with your prescription, or if you don't have a prescription, with nothing else. And that just allows you to calm your nervous system before you come in. Or if we've already started vision therapy, like in your case, and we need glasses anyway, I put them in just to add that extra level of calmness in there. So I was just saying to Larissa, one of the funny things is after you got your newest glasses, she walked by me in the hallway. I didn't even look at her. I just kept walking, and then I looked back. I was like, she's walking so quickly. You just sped right by. You looked gorgeous. You just walked on by. I was like, oh my goodness. So it really changes. Yeah. How did you
fast? It was immediate. And
yeah.
I think that you guys said that, okay, it might take a few days to adjust and you can go back and forth between your glasses, but it just eased everything right away.
Yep. And it changes your interaction with the space around you. So after a concussion, our perception's different. So I said sometimes you can get that tunneling. So sometimes you do glasses that open up your space. That really, really helps, just so that you can interact a little bit with more of the environment. But sometimes it's the opposite. You feel really scared or really unsafe in your environment, so we bring it back in. So there's so many different ways that we can use prism in a therapeutic sense. So we're putting that in your glasses. But we also use them in therapy, and you can see this prism is very, very thick. So that's something that's very different from what's in Larissa's glasses.
You can see that it's about the width. Oh, it's bigger than the width of my finger.
So this is 15 prism diopters, which is quite thick, versus I think I put 0.5 in yours. So the amount that you actually need to function day to day, if I put you in these, you'd feel very drunk very quickly. But these have their own purpose. So these open your space up to an uncomfortable level, but in here, when we're spotting you and watching you and supporting you, it's a very good tool to open space. So when I was doing therapy, they used to make me start every session with these, which I hated. But what it would do is it just opens the space. So I'll just show you, because you haven't done this yet. So I will show you.
Thank you.
Because I love to do it so much. So when I put the base at the bottom, so that's the thick part of the glasses at the bottom, what we would do is I just take in my space. It looks totally different than before I put these glasses on. I feel really small. The space feels really large. And what we do is we just walk and we observe space. And usually we walk down and back. And then what we do is we actually shift the orientation of the prism. So what that does is it just makes us aware of all of our space, which usually in a concussion we're not. And then it just helps at the beginning of the session. So you can also do that seated, but it helps, movement always helps you interact with your space, which is good.
During my intake session, I had those glasses on, and Dr. Rae said, "Do you want to take a picture with me?" So that's going to be the cover photo, the
That's
thumbnail
great.
for this.
I know, it's one of those things, and I had to use these glasses with a very small amount of prism in order to just process my space when I was starting out after my concussion. And it was a real hit. It was when I think one of the Despicable Me's had just come out, so
Nice.
that was really a big crowd pleaser for that. So
Thank you so much, Dr. Rae, for the tour, for answering all of those questions. If you have questions for Dr. Rae, I'm going to drop all of her contact information in the description below. And please let us know if this was helpful and if you have tried vision therapy and what the impact has been on your concussion recovery. Thanks so much, guys. Have a wonderful day, and remember that you are not alone in your concussion.
thanks so much.
Thank you.